Hello, my name is Colin Welker, and I'm the Senior Program Specialist with the Screen Our Circle program here at the American Indian Cancer Foundation. Today, we will be hosting a webinar called Sharing the Value of Cervical Cancer Screening. It is my privilege to introduce Dr. Galen Richards, who is contracted. Oh, I messed up.
You're doing fine.
I know, but I was going to say it's my privilege. What was I going to say? Something about privilege to be contracted.
No. It's my privilege to introduce Dr. Galen Richards, who currently contracts with us to provide the nurse specialist role.
I get nervous speaking. I don't know why.
No, you're doing fine. Okay, so this is going to be it now. This is
All
our
right.
last take number 3.
Hello, my name is Colin Welker, and I'm the Senior Program Specialist with the American Indian Cancer Foundation's Screen Our Circle program. Today, we will be providing the webinar, Sharing the Value of Cervical Cancer Screening. It is my privilege to introduce Dr. Galen Richards, who currently contracts with the American Indian Cancer Foundation as our nurse specialist for the Screen Our Circle program. At the American Indian Cancer Foundation, we imagine a world without cancer. Our mission is to eliminate cancer and its impact on American Indian and Alaska Native people through education, improved access to prevention, early detection, treatment, and survivor support. Galen, will you take it away?
Thank you so much, Colin, for that very nice introduction. Today, we will be talking about a very important topic, cervical cancer and cervical cancer screening. And our objectives for today will be to discuss the importance of early detection of cervical cancer, review current cervical cancer data, and we have both national and more regional data, identify the role of human papillomavirus in cancer carcinogenesis, discuss prevention and HPV vaccine, and identify a resource available to increase cervical cancer screening. Worldwide, we know that this year, as has it been for many years, that about 500,000 women worldwide will be told they have cervical cancer. When we look at rates of cervical cancer across the world, we do see a relationship between countries, Central and South America, Southeast Asia, and Eastern Africa that also have very high rates of human papillomavirus infection. We know that there is a linkage and that we can do something about prevention. Here's a little bit of data from the US. In 2019, over 13,000 women will be diagnosed with invasive cervical cancer, and there will be 4,250 deaths. 99% of cervical cancer is caused by persistent infection with human papillomavirus and is almost 100% preventable with screening. There's a slow progression from changes on the cervix by the presence of HPV to an invasive cancer. We have a window of about 6 to 10 years, allowing us to have an opportunity for women who engage in regular screening to find changes and treat them before they become a serious problem like cancer. We do have a pretty good screening rate here in the US as a whole, but not in every community and in every population. Nationally, half the women who are diagnosed have never had a pap smear, and another additional 10 to 15%, it has been more than 5 years since their last pap smear screening. This is some national data from the Center for Disease Control and Prevention, and this looks at new cervical cancers in the year 2016. That's the most current year we have data for, by race and ethnicity. This is per 100,000 women. And you can see that in our country, the highest incidence of new cases is among our Hispanic women, but our rate in American Indian and Alaska Native is about 6 women per 100,000. And remember, cervical cancer is almost 100% preventable with regular screening. I wanted to take a look at screening rates by race and ethnicity. Unfortunately, CDC does not divide into screening for American Indian and Alaska Native, but I did want to give you kind of an overall look across our country. Of course, many factors influence why a woman engages in screening or not. It may start with just not having their provider tell them they need to be screened, not having an awareness of the benefit of regular cervical screening, access to screening resources, and also insurance. So again, this is national data. I wanted to give you a look by uninsured and insured, what the difference in the rate, and you see a significant difference in the rate based on, of course, having insurance or not being insured. Of the primary goal of regular cervical screening is the early detection of changes in the cervix that then can be treated when they are precancerous to prevent that spread and progression to an invasive cervical cancer. Of course, I don't know anyone who really likes to have this exam done. It's a very personal exam, but by having regular screening, it's how we empower ourselves to better health. And I will continue to emphasize the point that with regular screening, this is a cancer that is almost 100% preventable. We have a big thank you to Dr. Papanicolau. He was a Greek physician, and in the late 50s and early 60s, he developed the Pap smear. Once this was out and available to women over the years, and we'll see some data in just a moment, the number of cervical cancer deaths dropped by about 2/3. And remember, most of what we're seeing women being diagnosed with invasive cervical cancer are women who have not been screened. I think this is a really important slide, what we have been able to achieve over the last several decades. We have dropped the number of new cases in half in the last 25 to 30 years, and our death rate has declined again almost by 50%. Our risk factors for cervical cancer are not being screened, either with a Pap test or co-testing with HPV, and we'll look at the screening guidelines in just a moment. Persistent infection with human papilloma virus, and I'm going to talk about that. Increased exposure to HPV, and that may be because engaging in sexual practices at an early age or multiple sexual partners. If you have a co-infection with HIV, you are more at risk. If you're a smoker, you're more at risk. And for our young people, and now up to age 45, 46, not being vaccinated with the HPV vaccine. Here's who is at risk by gender, both for females. I have the peak age for HPV infection for both men and women. But again, we look at the number of lifetime sexual partners, the age of the first sexual activity, your partner's sexual behavior, how many partners they've had, smoking. There is some increased risk with use of oral contraceptives, and being uncircumcised or having an uncircumcised male partner. Human papilloma virus, there are well over 100 types of HPV that have been identified. A handful of them have been indicated in causing changes to the cervix that can lead to a cervical cancer. About 70% of the cervical cancers are related to HPV type 16 and 18, with others being 35 has had a lot of study, 45 has had a lot of study. There are other types of HPV that do not lead to changes that may cause cervical cancer, but they can lead to changes that are associated with external genital warts. 6 and 11 are the two that have been studied the most. When we look at HPV and cancer, and I apologize if this slide is a little bit small for you, we of course know the most about its relationship to cervical cancer, but it also has been indicated in a number of other cancers. And you can see that about 99% of the cervical cancers, but also we've seen an increase in vaginal and vulvar cancers in women. Those cancers are very, very rare, and suddenly now we're seeing an increase, and there is a linkage with persistent infection with HPV. For men, we have seen an increase in cancer of the penis and also mouth and throat. So we do need to be aware of our safe sex practices when we are being sexually active, and also as we learn more about HPV and its linkage to cancers, and also maybe ones that are sort of out of this realm, there's always new news and studies coming out, and be aware of that we continue to increase our knowledge about cancer and its link to HPV. As I mentioned earlier, there is a long progression from the initial infection with HPV. It is thought that most of us will clear HPV over 6 to 9 months. Our immune system will kick in, we'll clear it. We may never even know we have it. But for some, we don't clear it. And so that persistent infection can cause changes over a year or two to the cervix, and I'll talk about cervical cancer here, that will cause changes that can be picked up on regular screening. If it's not picked up, if regular screening doesn't occur, the progression continues, and we think that window is about 6 to 10 years, possibly longer, possibly less, depending on the individual, that leads to that high-grade cervical dysplasia or changes, and then to an invasive cervical cancer. Looking at it in a different way, I thought this was a really good, a little bit of a different way to look at it. We have our risk factors that may lead to increased exposure to HPV, and also those folks who just don't clear that HPV and have a persistent infection. And again, that may be related to immunosuppression. They may be a transplant patient, have a comorbidity of HIV or an immune disorder underlying, be a smoker. And we go on and we just don't clear it in the way that someone with an immune system that's working at its peak would know. And we continue to learn more about this area, so stay tuned for more information on that. Here's our guidelines, and the guidelines have changed over time. So right now, it's not recommended that women under 21 get cervical cancer screening. Of course, that is a little bit at the discretion of the provider, because it would be the provider who would understand the cervical history of the client. Women who are age 21 to 29 receive a Pap test every 3 years. When you turn 30 to 65, you can choose a Pap test every 3 years, or you can screen with a Pap test and HPV co-testing every 5 years. And the latest change that came out in 2018, you can also choose to just do HPV testing alone without a Pap every 5 years. Women who are 65 or older, if you've had an adequate screening history and are not at high risk, you no longer need to screen. Women who've had a removal of their uterus for a high-grade precancer or for cervical cancer, unless it's been for that, unless you've had a hysterectomy for a high-grade precancer or cervical cancer, you do not need to screen. So some women have their uterus removed for non-cancerous reasons. Again, you can stop at age 65. But if you've had that, if you've had a precancer or cervical cancer, you will continue to have regular collection of a specimen for up to 20 years. And you would work with your provider on what is the proper collection interval for you. Little bit about HPV vaccine. There are 3 vaccines available, and they can be given as early as 9 and up to age 26 for our young males and females, and now recently up to age 45 for both men and women. You can see the types of HPV that they each protect for, and the Gardasil 9 has the most comprehensive coverage of a number of different HPV types. And it started out that you got 3 doses at 1, 2, and 6 months. Now 2 doses are considered acceptable. And we just had a podcast on Monday with a GYN oncologist, And the question came up about, well, I had one dose, but I didn't go back. And she said, you just go back and you just restart. You don't go back to dose one. You just, even if it's been a longer interval, you just take that next dose and go forward. So that was really a really good clarification. So if you've had one dose, but now you forgot to go back and get dose number 2, go right ahead and go and do that. We really want our young boys and girls to be vaccinated kind of between the age of 11 and 12. Here's another way to look at our vaccines, just presented in a different way for you. And so if this might be a useful tool for you to use with your clients, please go right ahead and do so. We do have a number of resources available to you from the American Indian Cancer Foundation. It is Cervical Cancer Awareness Month, and in the month of January, AICAF does have Turquoise Tuesday. That will be January 21st, both social media and cervical cancer awareness events at your clinic. And also the whole month, make it available to those who are coming into your clinic and have that awareness of yourself. We have a couple of infographics that are just wonderful. You can download them from the website, or you can order them through the email. I particularly like this one. It's really does a wonderful job of talking about risk factors, prevention strategies, screening guidelines. And again, you can order these from our website or by email.
Thank you, Dr. Richards, for that informative webinar. If you would like to contact us, you can email our AICAF at screenourcircle@aicaf.org or give us a call at 612-314-4848. Thank you for joining us.